A very good morning, dear students. So yesterday we have discussed about psychotherapy when we were doing the substance use disorder, the treatment modalities. So we will try to understand what psychotherapy is all about and why psychotherapy is so important, and you will later on understand as we review again the other F20, F30, F40, F50. Okay, the classification of mental illness, how psychotherapy play a major role in their treatment modalities, right? So we will try to understand. First, we will understand this psychotherapy. Then we will do cognitive behavior therapy, so that you can understand a bit in continuation from yesterday's class. Then we will do the other remaining substance. Drugs or the substance use. Okay, now why is psychotherapy so important? Let's try to understand. Uh, a lot of adults nowadays, not only adults, everyone they experience many stresses in life, right? So these stresses lead them into depression, lead them into a lot of anxiety, and then displacing them from the normal biopsychosocial equilibrium. Thus, they need help. Some of them need help with coping with a serious illness. Some of them need help with losing weight. Some of them struggle with coping with relationship troubles. Some of the people struggle with the loss of job or the dissatisfaction or not able to cope with the job stress, the death of a loved one, many other stresses, substance abuse, and other issues. Right now, from where does all these issues stem? All these issues stems just because a person is not able to balance himself or herself, be it any age group or in the biopsychosocial realm. Right, so always keep in mind the biopsychosocial realm, that model, in how the contributing factors contribute to the many clinical signs, to the many signs and symptoms which a client have deviating from the normal mental health. Right now, deviating in the normal mental health continuum. Right. So, because of these, there are many treatment and therapies to help cope with these problems, and psychotherapy is one of them. What are the other therapy? We have physical therapy. Physical therapy we will learn when we will do F30, right? Where they give ECT. Some of us, it is one of the seminar presentation of one of the students too. And then we have other therapies too, the psychopharmacology. Right, the psychopharmacotherapy, where we will study about drugs and how drugs they help in the treatment. And then we also have the other nursing intervention. But of all the problems, you will see that psychotherapy is one of the therapies which is part of the treatment modalities for a person with mental illness or deviation from the normal mental health. Right now, let's try to understand. Now, what is psychotherapy all about? Anyone else is there waiting to be admitted? Okay, hospi. Okay. So, we will try to understand what psychotherapy is all about. Psychotherapy is a treatment. Okay, as I've told you, we are discussing treatment modalities. I'm doing psychotherapy so that you understand from the F10, right? The F10, the substance use related disorder, how does it help, right? So psychotherapy is a treatment that involves a relationship between a therapist and a patient. If it is also so, who gives the psychotherapy? Psychotherapy is being given by a therapist, right? Now, it can be used to treat a broad variety of mental disorders and emotional difficulties. The goal of psychotherapy is to eliminate or control disabling or troubling symptoms so that the patient can function better. Now, as I have told you, what is the main goal? The broad the broad objective or the main goal or the main philosophy around the psychotherapy is what? It is to eliminate. We eliminate these symptoms or the possible stressors or possible factors that predispose or that precipitate or that perpetuate, right? We remember those factors, right? So either we eliminate, if we are not able to eliminate, at least we control them and we teach the client how to handle with these stresses so that a client can have a better equilibrium or a better harmony in the biopsychosocial realm. Okay, now therapy can also help build a sense of well-being and healing. Who is there? Please try to come on time, dear students. Now, in short, what is psychotherapy? If you talk of psychotherapy, the main concept is there is a therapist and there is a patient, right? A patient here is the one who has a problem or who has many stresses, and these they predispose or they precipitate a person into many areas or many signs and many symptoms of the in the makes them deviating from the normal mental health, right? So this person needs help, right? So who gives the help? The therapist gives the help. That help or that treatment is called the psychotherapy. Now let's continue. Now problems helped by psychotherapy include difficulties in coping with daily life, the impact of trauma, medical illness or loss, like the death of a loved one, and specific mental disorders like depression or eating disorders. Or other times you will see the psychiatrists and any other mental health professionals can provide psychotherapy. Can we nurses provide psychotherapy? Yes, after we have learned. After we have learned about all these mental illnesses and the psychopathology, the treatment. We understand about it. We are part of a mental health team. So any mental health specialist or any mental health professional can provide psychotherapy. Now, who needs psychotherapy? Right. Now, who needs psychotherapy? We have seen the main difficulties is coping with daily life. Again, from where does this coping problem come? It is because a client cannot balance his negotiation or in the realm or in the relation or in maintaining the equilibrium, the psycho-equilibrium, right, between the him as a person, the psychological realm, and in the social realm. Now, let's go. What are the aims of psychotherapy? Now, the aims of psychotherapy is to reduce anxiety and distress to tolerable levels. Now, why is psychotherapy needed in the first place? Psychotherapy is needed in the first place because a client cannot cope. Right. Now, if a client cannot cope, if a client cannot handle the stresses, so what happened? There will definitely be a lot of anxiety. Right. So each stem to the others. When we were discussing in the clinical discussion topics, when we had Sankhya posting, I told you there is no single factor that predisposes or that makes a client susceptible or that cause the deviation from the in the mental illness continuum. Right. So because of that, there is a lot of anxiety, there is a lot of distress, and when is the stress become a distress? Stress at a particular level is good, right? When does it become a problem? When it has reached or when it has crossed the tolerable level of a person. Okay, so psychotherapy aims in reducing the anxiety and distress to the tolerable levels. The other aim, it improves the pattern of behavior so that the individual's action are the most appropriate and best adapted to his circumstances. Again, please try to understand. Okay, think. conceptualize in your mind, in your thinking, from where does the behavior stem? It is because a client is not able to cope, right? It is because a client is not able to handle the various stresses. So from there, if a client has poor coping, how do we know? We will know only by their attitude and by their behavior, right? So when is the behavior or attitude or the action better? When a client will learn how to cope best with his or her daily life and with his or her daily circumstances. Now, is this a one-time affair, the coping of a person? No, we cope every day. Every day is a new day. Every day we live. Every day, the existential model, one of the conceptual model, or is the existential model. We exist every day. Now, when we exist every day, we fight for our survival every day. Now, when we fight for our survival every day we meet with circumstances, either be the physical, the biological circumstances from the biological realm, or from the psychological realm, or from the social realm. Right. So all this, if a client is not able to adapt, so psychotherapy aims to improve in the patterns of behavior. Once the person can improve or adapt better, definitely his action or his response to any situation or to any circumstances will be at a better level or in a better way, thus optimizing the psychosocial well-being or the over psychological well-being of a person, thus improving the quality of life at the ultimate level. Okay, now the third aim to increase the patient's insight and awareness of his own feelings and reaction. Now please try to understand. We are talking of psychotherapy. We are talking of a therapy which is related to the psychological or the mostly the the biopsychosocial sphere and their relation, right? Now, a person will have a lot of problem most of the time. I told you yesterday, if some problem is there with cognition, right? Now, most of them they know their own self, but some of them, some of the person they do not know. So, what does psychotherapy do? It helps to increase the patient's insight. Once the patient's awareness of oneself is good, once a person understands where are his plus and minus points, once a person understands how he relates to things and how he responds to things, thus he will be able to handle any situation. So the third aim is to increase the patient's insight and awareness of his own feelings and reaction. Okay? Now, what are the phases of psychotherapy? Now, how does this psychotherapy goes about? Okay, now I will do this psychotherapy in detail because from this you will understand all the other therapies that CBT I will be teaching you, behavior therapy we will be discussing together, and some of the other therapies your classmates will be doing your individual presentation. Okay, now, but please try to understand, okay, what is the phases which is there in psychotherapy. Basically, it has three phases. Okay, the first phase is ventilation, the second phase is interpretation, and the third phase is re-education. Now, psychotherapy in itself, from the name itself, psychotherapy, it is a therapy or it is a helping relation or it is a process or a therapy which a therapist give to a client. Now, you have to understand, if I am the therapist and I give psychotherapy to person A or B or C, right now, until and unless person A ventilate his problem or speak out what is his problem, I will not be able to analyze, which is the second part. I will not be able to analyze and I will not be able to interpret where are the possible factors that contribute to the patient's problem. And once I know what it is, then only I will be able to re-educate the client. Right now, please understand this. If it is a person B, I cannot assume me as a therapist. I will not, any therapist, you will not be able to just presume or assume. Okay. Now, if you will recall in your theories of learning, okay, theories of learning, which in one of the theories of learning, conditioning is one, modeling is one, and we learn by experience. And we also know that no two persons are the same. And why are the problems not the same for any two person? Because a person in himself, in his biological realm, has his own relation with the psychological realm, balancing with the social realm. Right? So no two person can be the same. And learning is individual. So when we address their problem also, we have to address at the individual level. Now, so until and unless a person ventilate, until and unless a person speak out, until and unless a person tells, right, the therapist will not be able to analyze, make the interpretation, and then once they start, once they understand that these are the areas which the a client need, thus a therapist can give re-education. So these three phases, remember. Okay, now how does a person ventilate? And what does ventilation do? Ventilation is the catharsis. They call it catharsis. Catharsis is what? Catharsis is the whole process where me as a person, if I go to a therapist for help and I speak out, right now, when will I speak out to the therapist? Only remember the counseling, remember guidance and counseling we have learned in CT, it is my class only. Now, we have seen that if and when we had learned therapeutic communication too, therapeutic nurse-patient relationship, when we had learned, when we had discussed all the phases. Now, when we gain the trust, now how will I gain the trust of the client? Right? If I will not gain the trust of the client, if me, myself, I don't trust my therapist, I will not speak up. Now, if I do not speak up, the therapist will not be able to help me or will not be able to link or will not be able to analyze what are the factors that predispose, precipitate, perpetuate or all these factors, all these multi factors that contribute to my problem. Now, why should I tell my therapist if I don't trust my therapist? So, what happened? The psychiatrist here, he encourages the client to release his emotional tension, to speak up of all the internal conflicts, frustrations, unhappiness by expressing his life situation openly. Right now. So, the therapist, if he or she can gain my trust, can gain my confidence, and the bond is a trusting and a willing professional relation, right? Thus, I will speak up. And when I will speak up, so the psychiatrist listened. Okay, in ventilation and catharsis, when the clients speak up, the psychiatrist listen. Now, whatever I speak up, right? The entire process is called catharsis. Now, why is catharsis needed? Why is the problem? In most of the cases, please remember when you handle about mental health, when you handle mental illness, or when you collect the history, that's why when we do history collection, we take care from all the preconceptual up to the current stage of life of a client. Why? Because these contribute to the learning. Either the client is being modeled in that way, life situation condition the client that way. Okay, some of the clients' comfort zone, they learned it. Some are learned behavior. Some because they suppress it, they didn't want to speak up, or the defense mechanism of repression, regression, right? You all have learned about defense mechanism. So what happened? When we face a problem at that point of time when we cannot handle, so what happened? We suppress it to the unconscious level. Okay, now it stays there. Now, but all those, anything which is suppressed alive, it causes a lot of internal conflict. I will not understand that these are the contributing factors to my problem, right? But anything which is buried alive in me cause a lot of problem. Now, how does this problem comes out? You will see. Buried feelings, how do they come out? They come out because, again, in my relationship of the biopsychosocial relation, or me balancing these realms of my everyday existence, the some of us adjustment is there, some of us it leads to maladjustment, then it leads to attention, it leads to anxiety. So all that is there. So ventilation, the process of ventilation, the process of me or the process of a patient speaking up, that is catharsis. Okay, catharsis. So catharsis is what? Catharsis is just speaking. Just go on speaking. Speak, whatever a person has inside. Okay, from whatever time they remember from the childhood, then this is this, either some from whatever age they could remember, and they speak. The more honest a client is, okay, the more honest the client ventilate out, the better the psychiatrist will be able to help. Now, over here, the psychiatrists play a role of the active listener. Now, what happened in interpretation? That is the first phase. So, me as a client, I have ventilated out to my therapist, and I look for help. How do I help? How do I come out with this problem? Right now, what happened in interpretation? In the ventilation, the client speak, the psychiatrist listen. Now, in the interpretation, it is the duty of the psychiatrist to understand all those behavioral, all those attitude, all those the outcome, right? And the person link these behavioral manifestation with the repressed intrapsychic conflicts. Now, please try to understand intrapsychic conflict. Intrapsychic conflict, you all know the levels of communication. You have that intra-communication, right? Intra-communication is inside you. You speak to yourself and you feel, oh no, I'll do this. I know we have discussed a lot about this, right? That's why I said self-awareness is there, right? Now, so what happened? All these, the conflict which is inside, which me as a person, I have suppressed or repressed. Why do I suppress or why do I repress? Because it is a defense mechanism, because I don't want to handle, or at that point of time, it is the best defense mechanism for my existence, right? So all this suppress, whatever suppress, it manifests either in my words, either in my action, either in my daily life management. Right now, so when do a person go to a therapist? When a person has problem, right? When a person cannot handle, when I cannot handle anymore, then I go, right? So I speak up. The therapist try to understand and try to link all these factors that contribute, right? Then after the person had linked, then what does the therapist do? The therapist analyze the behavior of the client to formulate the diagnosis and the plan of action. Remember that steps in the counseling? Assessment is there, right? And then we formulate, we list these are the problems, so these are the possible diagnoses, and how do we handle that? Now, once a therapist has known, once we know and we understand what is the problem, what is my problem, then the next phase goes to re-education. In re-education, the therapist helps the client to learn the ways of solving the internal conflict in a socially acceptable manner. Remember, a person have to balance himself in his biological realm, in his biological sphere, the psychological sphere and the social sphere. Man is a social animal, so always think. For me, my understanding of mental health and my understanding of the division of mental illness and all the contributing factors stem out from the disturbance in this balance between the biological sphere, the psychological sphere, and in the social sphere. No single sphere is independent of the other. Right. All these spheres, they are dependent on each other and they are interrelated. So what happens when a person cannot balance? So it stems out into conflicts and into problems. So after the person have ventilate, then the therapist analyze or make the interpretation. Then after that, the therapist helps in the last phase of psychotherapy, the therapist helps the client to learn the ways of solving the internal conflict in a manner which is socially acceptable. Right. So we have to be productive in our everyday in the community. So the way of solving also has to be acceptable. Right. So the therapists teach, and thus this reduces the accumulation of tension in the unconscious mind. Now, the other thing, the other concept which you will understand about psychotherapy. Okay, I like to give the examples of a pressure cooker. You all, if you don't know how to cook also, you must have seen how your mom or your dad or anyone who cooks at home, what happens to a pressure cooker, right? A pressure cooker, we put inside and we add water and then we put it to boiling now. And then in additional to that, there is a whistle which we add in the to the cooker. Right now, how do they know? How do we know? Or how my mom and I, most of you by now, you must be knowing cooking. When does the whistle? When does that whistle start whistling? When the pressure inside is more. Okay, now when the pressure has increased, right, it is boiling, and then it whistle off and it let go of all the extra pressure, right, to a point that the whatever is being cooked gets cooked. Now, just imagine if the pressure cooker whistle didn't work. Right. You must have seen whether it happened at your place or not, but I have seen at least in my place or in my neighborhood. Sometimes the kitchen is full of the dal, or sometimes the meat gets burned, all that. Right. When now, if the whistle didn't work, the pressure cooker bursts. Okay, now, so the same thing, in psychotherapy, whatever the person have accumulated inside, that causes a lot of tension in the unconscious mind. If you will remember topography of the mind, just for 1 second, think of the topography of the mind. Topography of the mind, we have the conscious, we have the and then we have all those levels, the semi-conscious and the unconscious and the subconscious also, right? So when all these things are accumulated, so when it is too much, it creates a lot of tension. And all these tension seeps out in the form of anxiety or in the form of pain, right? Now, so these three phases are there with psychotherapy. Now, so what is the psychological process which is involved in psychotherapy? What is the psychological process? Okay, the whole process of psychotherapy. Let's see. There is a process of repression, sublimation, transference, countertransference, rapport, and resistance. Now, this process is the whole process which takes place between a therapist and a client. Who is a therapist here? A therapist here is a person who helps the client with the problem. Right. Now, who is the client? The client is the one who has a problem and who seeks help. Right, who requires psychotherapy. He can be having problem with his personality, he can be having problem with his anxiety, he can be having problem with substance use, he can be having problem in his family, he can be having problem, he or she, okay, can be having problem with his daily coping skills, all those, right? So that is a client and here. Now, what process goes on between a client and a therapist is this: repression, sublimation, transference, countertransference, rapport, and resistance. Please try to connect and please try to be awake, students, so that you will be able to relate. Okay. Now, I hope you are understanding. Now, so let's see what happened in the repression. What is repression? Repression, getting relief by pushing forcibly the painful traumatic events or situation in the unconscious mind. Repression is what? Repression is a defense mechanism. We face situation in life, right? These situation may be traumatic, situation may be unpleasant. Mostly we repress the unpleasant one. The pleasant one we hardly repress. Most of the time, it is the unpleasant or the traumatic events or feelings or situation that we push forcibly into the unconscious mind. What is that process? The repression. Now, where does this repression takes place? Repression is not with the therapist. Repression is with the client. Right, because he has repressed so much, so there is so much tension and internal conflict. That's why it disturbs his normal daily adjustment in life. Therefore, he had come to a therapist. Right, so that is repression. Now, sublimation. Sublimation is releasing the stressful situation which are stored deeply in the unconscious mind through socially permissible and acceptable manner. Right, now here. Sublimation is releasing the stressful situation. This is also what? This is also another defense mechanism. What happened? Whatever we suppress, we release it through socially permissible and acceptable manner. Okay, so this one is from where again? This one is from the comes mostly in this process. This is from the client. Now, transference. In transference, the client displaces his feelings and experiences, likes and dislikes over to the therapist. Here is when a person have ventilated. That first process, ventilation, right? So ventilation is the catharsis. Ventilation of catharsis is when a person displays all those repressed or sublime feelings, right, the likes or dislikes, over to the therapist, transference. Then the next process, the counter-transference. Now here comes the role of the therapist here, okay? In counter-transference, therapists will counteract the client's experiences and analyzes the situation. Here comes the interpretation part, okay? The ventilation or the catharsis part is from the client. Right, please try to understand this, okay? Now, the catharsis in the ventilation part is from the client. The client had spoke up, the client had ventilated out, the client had displaces all his experience. Now, mostly in psychotherapy, they are mostly the unpleasant one, or it can be clubbed sometimes, both the pleasant and unpleasant one, they speak up, because when they have catharsis, they go on speaking. And as a client and as a therapist who offers help, you should be good in listening. Remember your principles of psychiatric nursing. Never judge. Be an active listener. So we listen. Right. When we listen, we will find out we will be able to diagnose maximum of the problem and will be able to plan the plan of action to help them. Okay, now counter-transference is when the therapists make the interpretation, analyze whatever the person have ventilated out, make the nursing, if we as nurses, we give the nursing diagnosis, and if it is any therapist, they will diagnose what is the problem and also plan out what are the valuable advices so that the client will be able to overcome this situation or problem. Okay, now let's continue the other process. Now, how will the client be able to do that? The client will be able to do that only when the client maintains rapport. Okay? A rapport, what is a rapport? A rapport is a therapist wins the confidence of the client by developing good rapport, establishes therapeutic relationship to explore the information related to significant events present and past. And when a good rapport is maintained, that means the client gains the trust of the trust and confidence of the therapist. The more the client gains the trust and confidence of the therapist, the better is the ventilation. Okay, the better the ventilation, the better whatever is being suppressed and repressed and sublime inside will come out. The better it comes out, the better is the release of the tension inside. So once the tension is released, that means the pressure कम हो गया. जब pressure कम हो गया तो that sense of relief is there, right? And the therapist, on the other hand, helps the client to deal with these stresses and how to cope. Thus, a client will come out. It is a win-win situation for the client. The client will be able to understand, have more insight, and learn better coping skills and better coping strategies and better life management. Thus, the client will not go again into all these problems. Okay, now resistance. Resistance is what? Resistance, remember I told you when we had studied MBT. In MBT, role with resistance. Why does resistance is part of the process? Okay, it is a normal mechanism that we don't trust. From where does this resistance come? Go back to the Johari window. Please go back and try to recall that Johari window. Johari window, we have this open to all, we have known to all, we have the hidden, and we have the blind. Right. So, to only when me as a client, I will ventilate out, then only the therapist will know. Now, why should I ventilate? There will be always some things that we keep to ourselves, right? Which we hide, the hidden spots, right? So, the resistance, interference of expression of repressed conflicts. The resistance is also part of the process. Okay, there is no psychotherapy that will go smooth, bang on. It needs many sessions because sometimes the rapport develop faster, sometimes it takes time. Right, like when we have learned our therapeutic nurse-patient relationship, sometimes the phase develop faster and we get to complete. Sometimes we are not even able to end with the orientation phase. We are stuck in the working phase because when the client is not opening up to us, right? Or we are not able to understand. So resistance is always there. I'm just relating this to our therapeutic nurse-patient relationship so that you can understand the concept or the pattern of thinking of various individuals and why there is always resistance in this. Now, here, so in short, the whole process is there's repression, there's sublimation, transference, when a clientele, counter-transference, when a therapist begin to analyze and make interpretation and help, rapport, when the therapist makes a good, gain the trust and confidence, and resistance. I told you, most of the time, the psychotherapy, when we have learned MT, which is a role with resistance. Now, over here, though resistance is there, the more the trust, the better the trust and confidence, the least or the minimal resistance will be there. Okay, now, what are the indications of psychotherapy? Now, who needs psychotherapy? Remember, a client with neurotic illness. Neurotic because neurotic stems from stress and stress-related disease condition. Right? It means anxiety, neurosis, hysterical, phobia, OCD, mostly the stress and anxiety, the neurotic condition, which comes anxiety disorder, the GAD, the OCD, those with dissociative, those with seminiform disorder, those with obsessive compulsive disorder, right? And then some with post-traumatic stress disorder. Okay, most of the client of the F40 is the stress and are the neurotic disorders. Okay, mostly they are always indicated and they are candidates for psychotherapy. Now, psychotic illness, schizophrenic, depression, and mania, but only when a person is in acute psychosis, then we don't give that. We will see afterwards. Okay, then a person who abuse substance, a person with sexual deviation, a person with personality and character disorder, and a person with marital disharmony. Right. So these are the indications for psychotherapy. Now, why are others not the indication? When we will study about psychotherapy in the subsequent slides, you will understand better. Now, contraindications of psychotherapy. I told you, severe psychotic illness, psychotherapy is not. It is contraindicated. Organic psychosis in acute phase. Client who are unmotivated and unwilling to accept it. So, if a client is not willing to ventilate, you can understand if a client is not willing to ventilate. If a client is not willing for any catharsis, then there is no point of psychotherapy only, right? So, because if the client will not speak, then what will the therapist do? Therapist cannot make up story, right? So, clients who are unmotivated and unwilling to accept psychotherapy is contraindicated. Assaultive and destructive behavior. For them, these are also psychotherapy is contraindicated. Now, why? Assaultive and destructive behavior. Assaultive, because for a psychotherapy, you need trust, you need confidence. It is a give and take. Right, like suppose my therapist, me as a client, I trust my therapist, I speak up, I release, I ventilate out, and the therapist help me. But if I have assaultive and destructive behavior, it is very difficult to give psychotherapy. And group therapy in hypochondriasis. Hypochondriasis is a anxiety disorder or part of a somatoform disorder where a person always think that always magnify or think big of their disease condition, okay, of their physical symptoms. So in this case, group therapy is contraindicated. Clear? So these are the contraindications. Now, what are the unwanted effects of psychotherapy? Client may become excessively dependent on therapy or therapists. Remember when we had learned the types of counseling, then we have learned about directive counseling, and we have learned about the non-directive, and we have learned about the existential. Right. Now, what happened? Over here, if a therapist and a client does not strike a balance, that's why we create objectives, right? That's why sometimes the client become very excessively dependent on the psychotherapy or the therapist. The main goal is for a client to improve in their management of the conflict and to come out in a better quality of life. Okay, psychosocial well-being at its optimal level. So, a client sometimes the unwanted effect is excessive dependence is there. Okay, intensive therapy may be distressing to client, resulting in exacerbation of symptoms. Why do this explain why some of the client in Sankey during our Sankey posting, they have given strict instruction not to give them, right? So sometimes because during their intensive therapy, it can be a little distressing because the more they ventilate, the more catharsis takes place. Sometimes it is distressing to the client, it leads to exacerbation of symptoms. What is exacerbation? Exacerbation is the aggravation of the symptoms. Okay, and the another unwanted effects is ineffective therapy, waste time, money, and it damages the moral. So anything, a psychotherapy should be a win-win therapy always. It should strive to bring out the best in the client. Right. So if it is not effective, so time wasted, money wasted, and also it damages the character or the morale of a person. Now, what are the different types of psychotherapy then? So, psychotherapy are classified according to depths of probing. Let's see this. Depth of probing in the unconscious mind. The depth of probing. Now, why this is the first classification, the depth of probing? How much ventilation does the therapist require from the client? Okay, the depth of the probing into the unconscious mind. Remember, it is not the conscious mind; it is the unconscious mind. We ventilation and catharsis from the unconscious mind is the aim, right? Is there in the outcome of the psychotherapy, right? Now, the other classification is in the number of patients treated in a therapeutic session, which it can be group, which can be individual, which can be family, okay, a number of patients. And the other one, theoretical formulations used in psychotherapy. So these are the types. Now let's see. In the depth of probing in the unconscious mind, okay, depth of probing in the unconscious mind, we have three types. Okay, the superficial or short term. Superficial or short term is the supportive psychotherapy. That means whatever the patient tells, not in depth, whatever is the exact problem, that is short-term problem, so the client ventilate out and the therapist give a supportive psychotherapy. A deep or a long term, the depth of probing. If the client, if the therapist, if it is analytical in nature, when do you analyze? You analyze when you have various data. Okay, now when you have a lot of data from different areas, then you do the analytical type of psychotherapy. You will be able to do the analytical type only if it is the depth is of probing is little deep, and the session between the client and the therapist is a long term one, right? Now, and the third type is the educative one, or where we give the counseling when they need only either education in coping skills, either education in uh, social skills, education in stress management, education in how to give up and harm reduction, all that, right? So the depth of probing. So you probe only up to that, the educative level, right? So this is the first type. Now, the other type, number of patients treated in any therapeutic session. It can be individual. From the name itself, understood, one client at a time. It can be a group therapy. You will learn more about group therapy and about family therapy. Some these students will be doing as presentation. In group therapy, over here, the homogeneous group. You can give psychotherapy only to the homogeneous, which is 8 to 10 clients group at a time. In family therapy from the name itself, it is understood. Okay, now in the theoretical formulation used in psychotherapy, what all are there? One is supportive type, where the client needs only support. One is a re-educative. Re-educative, that means we analyze the therapist knew that these are the maladaptive behavior or the poor coping or poor life management. So what does it do? The re-educative psychotherapy aims at teaching new patterns of behavior and social functioning. The third one is reconstructive. Reconstructive is when you want to bring about a change model. Okay, like for example, some it can be both supportive, re-educative, and the reconstructive. Some client we need only the reconstruction part. Some we need only the re-educative part. Some we need all of this. Now, psychotherapy varies from type to type. Okay, from different type of person. So in reconstructive, from the name itself, whatever is not right, when there's a lot of disintegration, when we teach, we help them to integrate themselves and rebuild the new personality. That is the reconstructive type, where that means we apply theories, we apply model, right? So these are the theoretical formulation which is used in psychotherapy. So these are the types. Now remember the three types. Let's see again. Depth of probing, okay? That means whether short term, long term, educative, number of patients, individual, group, family, and the theoretical type where there is only a supportive type, a re-educative type, or the reconstructive type. Okay, now let's go on. So, who all is involved in this psychotherapy? Right. So from this we know, according who is involved, accordingly who all are involved. Okay, we have an individual, right? A therapist will be there, because if a therapist is not there, then who will give the psychotherapy? Either a psychotherapy give to a therapist give to a single individual, so individual will be there. Either a person give to a group, so group of members. Either a person give marital psychotherapy, so a couple will be there. Either a person gives to a family, so a family is there which is involved in the psychotherapy. Now, so according to the content and methods used, according to the content and methods, it can be analytical in nature, it can be an interpersonal in nature, the one that mostly this interpersonal, our therapeutic nurse-patient relationship comes here. It can be only cognition in nature. That means we give only cognition therapy, teaching them how to relate, how to respond, how to in the conditioning. This is mostly in the conditioning part, okay? Or it can be only behavioral therapy. That means we change the maladaptive behavior with the adaptive one, right? Or it can be cognitive behavioral therapy. Okay, so all psychotherapy aim at changing aspects of the patient. Right, so this is according to the content and method. Content means what? Whatever the person ventilate out. So we can give analytical interpretation, or in the form of interpersonal interpretation, or we interpret only the cognition level, or the behavior, or the CBT. So this is the according to the content and methods. Why you must be wondering why I am doing so much in detail? Because if you understand psychotherapy, all therapies you will understand. And you will be able to plan and give psychoeducation to a person, be it in the community, be it in the hospital setting, or you yourself as a psychiatric nurse. How will you help a person better? That's why I'm dealing this a little bit in detail. Okay, now, what are the characteristics common for all psychotherapy? It is interpersonal relationship. It is we use verbal communication between two or more people as healing elements. Okay, specific expertise on the part of a therapist in using communication and relationship in a healing way. These are the common characteristics. Then it is based on rational or conceptual structure that is used to understand the patient problem. Right? Either a person needs CBT, either a person needs only cognitive therapy, either a person needs only behavior therapy, either a person needs only supportive psychotherapy, or a person needs only educative psychotherapy or constructive. So this who how does one decide? Only when a person have made the interpretation through the ventilated content or material which is given by the client. Okay. Now, use of the specific procedure in a relationship that is linked to a rational. It is a structured relationship. When we say structured, that means we start and we end. Right, structured, like our therapeutic nurse-patient relationship, pre-orientation and we terminate, goal-oriented, time-bound, okay, right, and objective or oriented and patient-centered, structured relationship and expectation of improvement. Now, so let's see these individual psychotherapy. Let's try to see individual psychotherapy. From the name itself, it covers the broad range of psychotherapeutic technique individually. Okay, that means one client work with a single patient. Group therapy. Group therapy is between 6 to 10. A group should not increase 10. Okay, attending a 90-minute session, they can help more people and cost less. Client benefits from knowing others have similar problems. That's why we say a group therapy, group psychotherapy can be given to a homogeneous group. Homogeneous group is a group which have same similar problem. Heterogeneous is a group with different problems. So a homogeneous group is also another theoretical another type where we give the psychotherapy. Now, a group therapy in detail, you will learn about this. Carefully selected participants, they meet, and then leaders direct the members, then participants give their feedback, and then patients may also have outside individual therapy, self-help group, enable members to give up patterns or wanted behavior. Therapy group helps patients understand why. Okay, that means they are not alone. Others are also there. This is in group. So this is in short about this. I will not do in detail. Someone else will be doing this. Now, family therapy. Family therapy is a therapy which guides family members towards positive relationship and improved communication. This is also another part of therapy. Again, one of the students will be doing this. And then couples therapy. From the name itself, who is a couple? Couple who is in a relationship, right? Either a legally official relationship, either a live-in relationship, right? Anyone who is a couple. So over here, who needs psychotherapy? Couple therapy, that means there are conflicts inside, right? So it is designed to modify or to teach the couple how to handle the conflicts. Marriage therapy is different from couple therapy. Okay, this couple therapy can be only with one couple or different couples with homogeneous problem. They can be given. Indicated when individual therapy fails to resolve relationship difficulty. Most of the case, if it is a two couple, what to say, helping or giving therapy at the individual level will not help much, right? Because there you need two hands to clap, right? So solving one hand without solving the other hand, once they deal individually both the hand, both the sides, and then they come for a couple therapy so that whatever common problems or conflicts can be resolved. Therapy geared towards enabling each partner to see each other realistically. This is a couple therapy. Now, to understand this psychotherapy, now let's try to understand what psychoanalysis is all about. Analytical point of view, right? So, psychoanalysis is what? That analytical, that means analysis. Psychoanalysis focus on unconscious as it emerges in treatment relationship. Okay, now it is the insight by interpretation of unconscious conflict. Okay, it is most rigorous 3 to 5 times a week. It may last for years and it is a little expensive because if you have analytical can never be short term. Analytical is in-depth analysis. And if you want to do an in-depth analysis, you need longer time. Okay, now patient lies on a couch, the analyst unseen to eliminate the visual cues. Must be stable, highly motivated, verbal, psychological minded, and be able to tolerate stress without becoming overly regressed, distraught, or impulsive. This is the psychoanalysis. Now, what happened? Who is the father and who developed this is Sigmund Freud. Okay, now let's understand how psychoanalysis work. Psychoanalysis, you must have seen in movies and TVs, right? Those that means they have deep inside regress conflict. Okay, and so what happened here? Sigmund Freud, is the one who developed psychoanalysis, right? The first formal psychotherapy to emerge is psychoanalysis. Now we have seen psychotherapy, there is ventilation, interpretation, and there is re-education. We have seen also it can be supportive, it can be re-educative and reconstructive. We have seen also it can be analytical, or it can only be educative, right? Now, so the first formal psychotherapy, Sigmund Freud here. So what does he do? This couch is very famous. In a room, a patient is made to lie down here. Right now, the Sigmund Freud does not sit there in a room. So a a person lies there, and that trust and confidence is there, right? And the person continue to speak up, ventilate out, and either a person record, I mean the analyst or the here Freud, Sigmund Freud listened or make the recording and make the analytical interpretation. Okay, now let's continue. So the basic concepts include in this stage is the oral, anal, and the phallic. You have learned this in psychosexual development theory. I told you also to review. If you have not reviewed, you have learned this in your psychology class, please go back. What happened in the oral stage? What happened in the anal stage and in the phallic stage? So what here, psychoanalysis, the concept, he says that maximum of the drive, maximum of the motivation, maximum of the learned behavior, or the way the cognition takes place is the relationship between the psychodynamic and ego superego. Okay, and it also deals with the concept of those conscious, semi-conscious, unconscious thoughts also. Right now, so psychosexual, please remember psychosexual development, the id, ego, superego relation, right? And the topography of the mind. So whatever is there, this produce or this drive or this bring out the overall personality or the overall makeup of the person. Okay, now, so the goal here is structural reorganization of personality. Technique is here interpretation, clarification, working through dream interpretation. This is a little higher level, but I thought when we have studied psychotherapy, psychodynamics, psychoanalysis, we need to understand. Okay, this is, you must have seen, those of you who watch movie and in YouTube, if you watch hypnosis, right, where they put the patient into trance, and then whatever the patient has inside, he speak up. Or some they do dream interpretation. This is my dream. This they call it dream analysis. These are high level of psychotherapy. Okay, now, so what is the aim of psychoanalysis? Okay, please try to understand. You will try to, after this, you'll be able to relate why taking all this childhood history and asking the patient to ventilate out right from there helps in the psychotherapy. Okay, since psychological problems originate from childhood repressed impulses and conflicts, the aim of psychoanalysis is to bring repressed feelings into conscious awareness where the patient can deal with them. One of the aim and one of the goal is to better insight of an individual, right? Now, so here psychoanalysis help to bring whatever a person have repressed come out, become more aware and better handling of them. Now, when energy devoted to id, ego, superego conflicts is released, please mark this. When energy devoted to id, ego, superego conflicts is released, the patient's anxiety lessens. So most of the time, you will understand maximum of the problem, repeated problem when we do CBT. Okay, when we give psychotherapy, we understand that it stems right from childhood. There is conflicts, internal conflict, childhood conflicts, emotional conflicts that the person have repressed. Now, How does all these conflicts come? Because a client have not passed through those psychosexual stages, or a client have not gone through each phase of Erickson's personality development phase. Right. So all these things stems out and brings about the problem as the individual grow in the growth and development of a person. Okay, so once these conflicts are released, so how do they release? So psychoanalysis is this: ventilation out, analysis, and more insight. And once a person understands, therefore anxiety lessens out. Okay, now the same term that they use. What happened here? See, there is transference. Transference means what? Unconscious redirection of feelings from one person to another. Okay, there's countertransference, redirection of the therapist's feelings for the patient. That means the therapist try to understand and help the client. Therapeutic alliance, therapist and patient trust, resistance, ideas unacceptable to conscious prevents therapy from proceeding, and free association. Patient says what comes to mind uncensored. When there is free association, when there is free ventilation, they call it the most healthy and healing and the most objective. Like, me as a therapist, I feel that when everything patients speak up uncensored, many clues and many clues to many of the patient's problem, I feel we can analyze better from there when there is free association. Now, so what happened here? The patient lies on the couch and speak whatever comes to his or her mind. Okay, here the method. Then during free association, that means patient speak whatever. So will resistance be there? No, there will be less resistance. So when there is less, okay, so the analysis becomes better. Okay, eventually the patient opens up and reveals his or her innermost private thoughts, developing positive or negative feelings towards the therapist. Okay, this is the method. Now, what is the psychodynamic psychotherapy then? These are just in short that I'm telling that we are only discussing. Psychodynamic psychotherapy, this is again influenced by Freud in a face-to-face setting. Psychodynamic therapists understand symptoms and themes across important relationships in a patient's life. Psychodynamic, id, ego, superego is every day with us, right? Our id wants something else and the ego itself, okay, balances between the superego and the id, right? So psychodynamic psychotherapy is this. Now, concepts are embodied in psychoanalytic theory. It does not involve rigidly defined techniques that characterize classical psychoanalysis. It is based on idea of self-exploration and self-understanding, open up the possibilities for change in personality and behavior. Now, so to understand this, see, when does the psychodynamic takes place? Okay, this is mostly important in personality disorder, sexual dysfunction, somatoform, anxiety, and mild depression. From where does personality disorder stem? Personality disorders stem because there is what to say, the id, ego, superego that makes up the traits, right? The topography of the mind, again, that stems in different traits, and then how the client goes through the Erickson different stages of personality development, and how a client passed through the Sigmund Freud psychosexual theory, the oral stage, the anal stage, the phallic, and the latent stage, right? So it says that maximum of the personality disorder, sexual dysfunction, somatoform, anxiety, or any stems from the disequilibrium or from the problem that stems from the repress or from the unfulfillment or transition in this, right? So psychodynamic concept is based on this. Now, over here, the psychodynamic is also called the insight-oriented. Why it is called insight-oriented? Insight-oriented means me as a person, I have a problem. But because of so many things repressed inside, I am not able to find myself. Right. So because I'm not able to find myself, I go to a therapist. Now, when a therapist gives psychodynamic psychotherapy to me, he or she helps me to ventilate out. So once I have expressed out, better insight, so the therapist analyze. So when the therapist analyzed, he sat with me and he said, okay, this is this, this is this, this is this. Maybe he linked to my problem. Thus, I have better insight. Once I have better insight, better awareness, I will definitely have better coping strategies. Okay, so in the insight oriented, couch is not needed. Couch is when a person goes on that ventilation, only go on speak that catharsis. Okay, and over here only allows in the person to transfer out and the therapist interprets, and this can take place between 1 to 2 sessions, open-ended, duration of limited course. Okay, now, so how do we give this psychodynamic? Remember, when you talk of psychodynamic, remember it stems from these, okay, the topography of the mind, the id-ego superego relation, and the personality development and the psychosexual development. Okay, now, so interpersonal therapy is based on idea that mental illness may reflect and be expressed in problems with relationship. Right. So it emphasizes working on improving interpersonal relationship during the process of psychotherapy. Now, do they put this inside psychotherapy? Yes, they do. Okay, now, so in types of psychodynamic psychotherapy, we have psychoanalysis that we have seen, or we have exploratory psychotherapy. From the name itself, exploratory aims at understanding motivation and unconscious forces which focus on current life. Okay, so we explore what are the problems, what are the stresses. That is called the exploratory psychotherapy. Okay, now supportive psychotherapy this is also under psychodynamic. Okay, now supportive psychotherapy, it lessens the anxiety through reassurance. That means we give support through giving advices. Then we help the patients get through difficult situation by understanding these stresses and how do they modify and how do they cope with the social factors. Okay, now it is incorporated in any of the other types of psychotherapy, which can be a short-term psychotherapy, right, which is a superficial, a specific, or it can be insight-oriented psychotherapy where it is an expressive one, right? We express and more insight is given towards the problem, or it can be interpersonal therapy. Okay, now the insight-oriented psychotherapy is what? Is again based on the psychodynamic concept. Psychodynamic again concept is the imbalance or the inability to balance between the ego ego. Right, now focus on interpersonal relationship here in our situation. The patient are encouraged to achieve an intellectual understanding of the mainspring of their behavior that will assist in changing it as needed. Okay, insight oriented. Remember, insight oriented means I understand myself. I have better insight. So if I have better insight, I am able to handle and I'm able to balance my ego, superego, and my relations is balanced, right? So insight oriented psychotherapy. Now, interpersonal, based on the idea that mental illness may reflect and be expressed in problems with relationship. Okay, thus interpersonal therapy is needed. So what this interpersonal therapy works with balancing or improving the interpersonal relationship, be it family relationship, be it couple relationship, be it stresses that cause from problems at work where a person cannot relate, be it any other relation, siblings problem, okay, a parent kids problem, be it among parents themselves or be it among clans. So all these therapies will come under interpersonal therapy. Now, humanistic therapy, humanistic humanistic therapy aim to boost self-fulfillment by helping people grow in the self-awareness and self-acceptance. Okay, better productive, better quality of life, better uh, what to say, life management skills. Okay, so what happened here in this, the therapist engages in active listening and echoes, restates and clarifies the patient's thinking and acknowledging the expressed feelings. That means mostly for if I want for my own growth, for my own live production, for my own personal growth, right? So what happened, I express my feelings, I go to my therapist, right? So my therapist listen and then he tries to help. Okay, either he restates, either he clarifies my own thinking. Thus whatever we express, right, that means my self-esteem is good. Right. Once my self-esteem is good, that means my productivity, my motivation and drives will definitely be good. And if my drives and motivation is good, the existence, my existence will be a good and a productive one. Okay. So self-actualization, realization, we reach there. Right. Now here. Client-centered therapy. Now, what is the client-centered therapy? The client-centered therapy is a form of humanistic therapy. A therapist listens to the needs of the patient in an accepting and non-judgmental way, accepting the client as a person. Listen, make objective interpretation, and help and address any problem in a productive way and building his or her self-esteem. This is a client-centered therapy. And then who can be therapists? Who can be? Okay? The clinical psychologists. Clinical psychologists, they have PhDs mostly. They are experts in research. They can do run the assessment tests, and then they know the various therapy, all of which is verified through a supervised internship. Okay, a clinical or a psychiatric social worker, they have masters of social work or postgraduate supervision prepares some social workers to offer psychotherapy, mostly to people with everyday personal and family problems. See, individual psychotherapy, group psychotherapy, family psychotherapy, any a person, any trained one can give. But from my own experience and from the experience that other person have, CBT is the one, CBT, cognitive behavior therapy, is the one that need more depth. It is more of the that in-depth one. Okay, the in-depth psychotherapy. For these, mostly you need that trust. Okay, and you need a one-to-one. A one-to-one helping relation. Okay, so for CBT, it is a little those the higher one where to bring about the change in the behavior. We will learn about this, right? So who can give? A clinical or psychiatric social worker can give. As a psychiatric nurse, can you give psychotherapy at your level? Yes. You help them, be it family, be it individual. Simple, you assess the psychosocial need. What is the need of the family or what is the need of an individual? And then you plan out what intervention you can give, and then you work out the intervention with the family or with the individual, and then you go for the follow-up. Now, those higher, intense, in-depth analytical psychotherapy, those you need experience, and those you need more qualified one. Okay, now, so with this, I end my class on psychotherapy. We have discussed psychotherapy. We have discussed the different types of psychotherapy. Okay, we have discussed about psychodynamic psychoanalysis and how we can do. So I think from this class you will be able to relate well why psychotherapy is so important in as a standalone treatment, mostly, or in adjunct, or in combination, or complementing the other therapies that a person with mental illness or deviation from mental health requires. So, if you have understood, I hope you have. Do you have any question? Only 28 students are there. I think most of you have left. So those of you who are still present, have you understood what psychotherapy is all about? Psychotherapy analysis, psychodynamic. Therapy is the one which goes from the ventilation, interpretation, and the education one. Right. Psychoanalysis is the one which goes more with the unconscious, the in-depth and in-depth analytical psychotherapy. And the psychodynamic, the concepts is based upon helping the person understand the understanding the relation between it, ego, super ego, right? And how does the transition in these psychodynamic phases the brings about the problem, or better understanding means better help the client will get, and better help the client, better insight and better response, or better coping the client will have. If better coping, less tension, less anxiety, so better optimal quality of life. Okay, now do you have any question? I will stop here. CBT we will do in the next class. We still have around 15 minutes. Do you have any questions, students?
Explain psychoanalysis again.
Nehamili? Okay, you want the psychoanalysis part, right? Now, okay. So, the psychoanalysis is what? Basically, the psychoanalysis, from the name itself, analysis. Okay, now, who started this understanding the concept of analysis? Analysis works only when there is the client, there is ventilation of a client, and ventilation or catharsis, free association. Free association meaning there is no inhibition that me as a person, whatever I want, whatever come to my mind, I speak up. Right. So there is less resistance in my part. Right. So I speak. When there is free association, the person who listens to whatever I ventilate out will be able to analyze from where the conflict stems. It can stem from the childhood conflict, okay, or it can stem from the early days of school, or it can stem from any stages of life. Now, how do we know what are the development in the stages of life? Erik Erikson theory explains this. Right? Right from early childhood up to geriatrics. That is one. How do a person go through the gratification and go through the psychosexual development? Sigmund Freud explained this in the psychosexual theory. Right, the oral stage, the anal stage, the phallic lid. Right. Now, please go back to these theory and read. Now, what is the concept of the psychoanalysis is? Psychoanalysis, from the word itself, you analyze. What do you analyze? You analyze those repress or regress or suppress conflict. When do we repress or when do we push the conflict? We push the conflict when the situation or events in our stages of life is not a pleasant one or not not a desired one, right? So we press it or we shuffle it or we push it into the unconscious, right? Now, in part of our defense mechanism as we cope with our existence of life, whatever we push out, most of the time it brings out conflicts. What conflicts? Internal conflicts. How do we know there are internal conflicts? Me as a person, I do not know, but I have problem with my everyday adapting my life, either in the psychological sphere or in the psychosocial sphere, either at home, either in my personal life, either in my relationship, either in my work, either in my coping. So I feel I am not able to cope and adapt. So I have problem. When I have problem, there's a lot of tension and conflict inside me. When there is a lot of tension and conflict inside me, anxiety, release. Now, this one I go to a therapist, right? So after I ventilate, after I ventilate whatever I need to whatever I ventilate, the therapist analyze and make the interpretation and educate. But some of the areas that stem from the inside, deep inside the unconscious realm of me, what is there in the unconscious realm, the one that I have pushed and regress, right? So for my therapist to analyze that, he needs to do psychoanalysis, right? Now, how will he be able to do psychoanalysis? He will be able to help me only if I will speak out, or only if I will express, only if I will bring out. Now, if I do not bring out freely, that means free association, if I have still some resistance, I choose what to tell and what not to tell. The person will still not be able to help me. Whatever I tell, he could analyze only that and he could help. But if I speak up, whatever comes to my mind, deep from inside, what they used to say, na, जो दिल में what how do I put, whatever is there in the heart, just speak, right or wrong, relate to this or that, makes no difference, just speak. Okay, that is the best catharsis, and the person analyze. Now when he do analysis of that, he handle with those deep internal conflicts. That is the psychoanalysis. Okay, understood or not? Neha Mili. So for psychoanalysis, Nadia, some of the feelings and the thoughts may be positive, some it may be negative. But if a person do psychoanalysis, he encourage me to speak up, okay, to express out. It does not matter. I don't have to relate anything from my childhood, whatever I remember. In my childhood, my mom did this, I enjoy this, I do this, and then I was unhappy with this, I was happy with this, right? So some positive, some negative, I keep saying. But my therapist keep on analyzing this, right? So once he analyze, he will be able to understand the conflict driven anxiety. Okay, the anxiety that drives, or that is the outcome of the conflict which is inside me. Understanding that, but understanding that, you need many sessions. You need that bond. You need that trust. You need a lot of session where you can speak up, right? So that method, this is psychoanalysis, the analytical part of the psychotherapy. What is the depth of psychotherapy and psychoanalysis? It is in depth. What is the term? Long term. Sometimes what is the formula for this? It can be re-educative. In most of the case, it is reconstructive too. Right. So because the client will have to teach me as a patient, the therapist, how to recondition myself. I have to recondition. I need to be to understand. I need to get better insight. I re-educate, or there has to be a change in me to bring about a change, or it has to be a reconstructive form. That is psychoanalysis. Okay, psychodynamic stems mostly for personality problem, those with the the condition, the learning problem. Right now, from where does they stem? How do we learn? How do we grow? Ego, super ego plays a role, right? And then and we pass through those different stages. So when we do deal with the dynamic, the ego, super ego, the development, that is the psychodynamic part. Do all this come under psychotherapy? Yes, it does come under psychotherapy. Because psychotherapy is what? Psychotherapy is between me, a patient, and a therapist. I have a problem, I go to my therapist. Then, depending on my problem, therapists do give me an individual problem, or give me a psychodynamic therapy, or give me a psychoanalysis problem. When do I require psychoanalysis? When my problem is deeply seated, deeply rooted in my unconscious. Okay, please read this. Refer. You can read more books. Okay, you can read this. I'm doing in detail because for you to understand the different therapies which subsequently you will be learning. So thank you so much. At least I'm happy with today's class. Student, you are able to ask. If there's still anything that you didn't understand, later on if we have offline classes, if it permits us, we can discuss it one more time. Thank you. Have a wonderful day. Please get ready for the next class.